Time now for Restoring the Soul of Healthcare from the HELPcare Clinic in Austin.
Always a pleasure to check in with the HELPcare Clinic here on our Thursdays visit with Dr. David Strobel and Lee Acey. Gentlemen, good morning.
Good morning, John. Thanks, John. Good to be with you.
And interesting topic today, because we've always talked about the HELPcare Clinic and memberships and being partners in all of this healthcare, but you've developed a plan to let people kind of test the waters, if you will, another way to be part of the HELPcare Clinic. And I don't want to give more away than that, because I want you to explain how this works.
So we recognize that this is a different model for a lot of people. They're not used to having a membership related to healthcare. And yet we've had more than 500 people from the area who have joined so far, and they've had a good experience with it. In the blog post today, we're linking to several of their testimonials. We've sort of solicited their testimonials. Some of them are in video, some of them are in print, but where they're telling their story. But, you know, for some people, they're just trying to get their head around it a little bit, and they're thinking about it. And so we've done, on occasion, we've said, well, we could see you for this thing for this particular health concern if you just do a 1-month membership. You know, we could just do kind of a trial membership. And as we thought about that a little bit further, we decided that it would be good to just develop a cash pay price for people who are thinking about membership maybe, but they just want to, they want to try it out. And so as part of the program, what we did some surveying of what people pay in the regular healthcare system. So we surveyed 6 different hospital systems, including Alina and Centricare, Fairview, Mayo Clinic, Mercy One, Olmsted Medical Center, Park Nicollet. And there are published on their websites their charges for different levels of office visit. And so as we were setting up our cash pay program, which we're describing in a blog post that's on the website today about non-member pricing, we said, let's just take the lowest price for each of those levels of visit and cut it by 25% and say that that's the cash pay price. That's the price for people who just want to try, a healthcare clinic and see what that experience is like. And so they're guaranteed they're going to save at least 25% because compared to the other hospital systems around or the other healthcare systems around. And this way, we can be really transparent about here's what the charge is. And it also helps our members appreciate, I think, what value they're getting, because they're recognizing that the appointments that they're getting are included in their membership at no extra charge. So if they were going to some of these other places, they'd be paying a lot more. So I think this will be a good way for people who maybe just haven't quite gotten ready to say, I want to join, I want to be a member, to be able to say, well, I can experience it. I can see what it's like, and we think an awful lot of them will be wanting to likely continue with membership.
I was going to say, a lot of people wouldn't buy a car without test driving it, so this is kind of your version of the test drive, and come and find out what it's really all about.
Office levels are based on really complicated coding rules and things like that under the insurance agencies and that kind of thing. And so we've got basically a reflection of the cash price for 4 different office level charges in a level 2 charge. Level 1 charge doesn't even require a provider. That can be just a nurse visit, for example. So those are almost never used. Level 2 is very, very low complexity, extremely brief visit, just one problem, very easy to take care of, that kind of thing. And then level 5 is a very high complexity visit, very comprehensive, higher risk and that kind of thing. Most of the visits that are done in regular healthcare settings are more like level 3, depending on the circumstance. When I was doing more of my billing type of work, then I would mostly use level 4 visits because I took care of a lot of complicated patients. But you can also look at this as based on how much time it takes. And so since the visits at HELPcare here are all designed to be, fairly relaxed and longer, then, technically we could, if we were billing those, we could bill every single one of them as a level 5 visit just because of the time involved. So what people are experiencing is that much more slow practice, and yet they're not paying nearly as much as they would if that kind of visit was being done in another place.
And looking at your blog post here today, too, and I would encourage people to go and check this out, because you talk about at a minimum saving 25%. And as you were discussing with those longer visits, and especially if it's something more complicated, actually you're going to probably see a little bit more savings on that, and really show how effective this can be in protecting your pocketbook.
And it's very common also that just one of the ways that the larger systems survive financially is by limiting what kinds of things people can bring up. So there's very little of the, oh, by the way, while I have you here, doctor. Mm-hmm. That just simply often is not allowed anymore, and that can run me behind as well, even in the HELPcare clinic. But we're more likely to be able to answer those, oh, by the way, now that I've got you here, can I ask you another question? And most of the time my answer is yes. And so that it's a different feel. It's not just that you get all this time. It's like, well, we can get some stuff done.
Yeah, and as you mentioned, I mean, it is likely a more significant even than a 25% savings, because we just based the savings or based the prices on 25% off from the other systems at their minimum level. I mean, the minimum of the lowest of the other 6. Mm-hmm. So other choices around here might be toward the higher end, and so the savings could be anywhere from 45 to 64%, I guess, even. So looking at the high end.
Yeah, it's a fascinating idea, and I was scrolling through your blog post that as people look at it and are trying to kind of wade their way through it, you have a form on the bottom if people want more information or even can send a message and ask questions. They certainly can do that right from the blog post.
Yeah, we want to be as accessible as we can, and so if they can put in a detailed question if they have that, or and we're happy to respond to those. They can also give us a call, and we're happy to discuss the various options that we have here as well. And one thing that we'd add with this is that these prices that we put out here are just for the office visits. We'd have comparable kinds of savings on the lab tests as well, so that there's, and perhaps even a little bit more, so that if somebody comes in and they need some lab tests done as well, that those can be also offered. And then, the thing that we think people will find out is that, that does kind of add up. And even at the discounted level, it's a better value if I go ahead and get the membership. And then I just don't have to worry about, and from our perspective, that's a better deal too, because as I was talking with Dr. Dave about this a little bit earlier, it does introduce some complexity for us, in the system. And so that's part of why there has to be, some additional charge for this, but it's still way less complex than having to fill out all the insurance forms and, haggling with the insurance companies. And so that's part of how we can keep the costs lower and pass the savings on to the patients.
The one question I have, and haven't been able to read in detail everything, say someone comes in and gives this the test drive, would they be able, if they said, I want to convert into a full member here, could they apply that fee to that, or would that be different?
The answer is yes, they can. And we'll have we're going to be announcing probably next week, kind of that conversion plan, as well as something that will make this more friendly to those who want to use health savings accounts, which they currently can't use for the memberships.
Right.
But because we have these specific charges associated, then that's something that they could be able to submit for reimbursement. So we'll be talking more about that later, but we will have a plan for people who do try this and then say, this is for me, that they would have an opportunity to be able to convert.
All right, man. You're giving it away almost, it feels like.
Well, I don't know about that. I mean, as Dr. Davis said, healthcare doesn't have to be that expensive.
Right.
It does. Yeah. It's just part of the way the system has been structured, and we're excited that by doing this in a little different way, we can, create some savings. But the most important thing is to really create that human relationship, that unhurried experience where people just feel refreshed and at home.
Yeah, and having that comfort level really plays in big when you're trying to move forward and get over something. Is just feeling comfortable with your healthcare provider is huge.
Yeah, the trust is essential, and that's part of what it takes to build that relationship and to have the patients ready to hear what the providers have to say. Is they have to believe that they have their best interests at heart and that they know and like them.
Absolutely. Real quick, let's just remind people again where they can find the blog post and how they can get more information.
Go to HELPcare.health. That's HELPCARE.health. Give us a call at 507-279-2345 or stop and see us at 308 4th Avenue Northwest. We're just a block east of St. Augustine's.
Gentlemen, it's always fascinating to talk with you each week and find out every week as we peel back the onion a little bit, more ways that you're accessing or reaching out to people and trying to help save on their health care. We appreciate it.
Thanks, John. Appreciate you helping to spread the word.
All right. Have a fantastic week, and we'll talk to you next Thursday.
Yep, good deal.
Thanks. You.
All right. Bye-bye.